Hello, good evening, everybody, and welcome to our Tuesday evening. And we're getting back into going through the different systems and things in the body. And essentially, I'm going through the product catalog so that we know you can keep track of that as to where I am as well. And tonight I am doing the part that keeps me in business, which is the musculoskeletal system. So in other words, all your bones and muscles and ligaments and things. And that's the part that I get to deal with on a very regular basis. And the sad part is that a lot of times I see patients, but I shouldn't be seeing them because I'm seeing them because of diet-related conditions. Quite often with fractures and things, there are diet conditions related over there with osteoporosis, etc. But I will go through all of that as we go along. I'll start off with a bit of an overview and take it from there. So let me share my screen. Shrinking that down. And I've discovered a new thing that I can do. Now I can see my whole screen. It's wonderful. So what is the skeletal system? Quite simply, it's our framework. It's what keeps us upright. The human skeletal system consists of all of the bones, cartilage, tendons, and ligaments in the body. There's a lot of things over there. Altogether, the skeleton makes up about 20% of a person's body weight. An adult skeleton contains roughly about 206 bones, providing none of them have been broken, in which case you've got a few more. And children's skeletons actually contain more bones because some of them, including those of the skull, fuse together as they grow up. There are also some differences in the male and female skeleton. The male skeleton is usually longer and has a higher bone mass. The female skeleton, on the other hand, has a broader pelvis to accommodate for pregnancy and childbirth. And there's a couple of other fascinating things that happen when you go into childbirth, but we're not going to get into that tonight. So what is the function of the skeletal system? Apart from being a framework that our skin hangs on, it actually has a few other jobs as well. Namely, protection is a big one. The skeletal system's main function is to provide support for the body. Go figure. For example, the spinal column provides support for the head and torso. We'd look a bit strange if we didn't have a spinal cord or spinal column because your head would be very close to your pelvis and yeah, things look a bit dodgy from that angle. The legs, on the other hand, support and bear the weight of the upper body while a person stands. And we are very carefully designed that our center of gravity sits slightly above the pelvis, and that is what keeps us upright. The body is an amazing piece of machinery, and despite all the abuse that we tend to put it through, it will do absolutely everything that it can to keep us upright. Some of us are obviously a little bit more upright than others through various reasons, but that is what your skeleton does. The skeletal system has several other functions as well as just supporting weight and having a place for you to hang your skin on. It protects the internal organs from injury. For example, the skull protects the brain, while the thoracic cage protects the heart and lungs. And I often refer to the skull when I'm talking to my patients as a fishbowl and the brain as a piece of sponge that's floating inside the fishbowl. And I won't get into all the technicalities, but that is how and why we get into trouble when we have a head injury, because the brain is floating around, but now it swells and it runs out of space. Allowing for movement, muscles attach to bones through tendons. And this connection allows the body to move in many different ways. And there's various different types of joints, and each joint works in a slightly different manner. And basically between every bone, so all 206 bones, there's always cartilage between those bones. And the skeleton is also handy for producing blood cells. The soft bone marrow inside of many bones produces red blood cells, white blood cells, and platelets. So without the bones, you're not going to have a good production of blood. And this is what happens when, if you look at this little picture here to my right, where you have the femur, if the femur breaks in roughly about that area, I hope you can see my cursor, but if you see the femur breaking roughly about there, what happens is you have a leak, for want of any better terminology, of the marrow and the blood cells. And that is what shoots through the body to cause a blood clot, which can cause all sorts of issues. The skeleton is also there for storing minerals and nutrients. Sorry, bones can store and release minerals, including calcium and phosphorus, which are important for many bodily functions. Additionally, adipose or fat tissue that can be used as energy can be found in part of the bone marrow. So your skeleton is not just a pretty looking cage. It has a lot of other quite involved functions as well. And that's why we need to look after it so well. So what kinds of conditions affect the skeletal system? We obviously know about fractures or broken bones. And a fracture and a broken bone are basically the same thing. Fracture is just a fancy terminology for it. And I do sometimes have people come to me and say, oh, thank heavens I didn't fracture my bones, I just cracked it. Little knowing that it's the same, technically it's the same injury. So you can get different types of fractures, but when your bone breaks, even if it's just a hairline crack, it is classified as a fracture. We also know about other problems, but we'll go through to that shortly. So fracture can also be referred to as a broken bone. And basically, any one of the 206 bones in your body can suffer a fracture. Obviously, we're more familiar with things like a broken arm or a broken leg or a broken hip, but any bone can be fractured. What causes the fracture? There are numerous reasons for that, but they include blunt force trauma, falls, osteoporosis, along those lines. Fractures typically occur due to an injury or trauma, such as a car accident or a fall. And there are many different types of fractures, but they're generally categorized by the nature and location of the break. So by saying that, we will talk about a fractured femur, which is the long thigh bone, or a fractured humerus, which is this upper arm bone, or a fractured clavicle, which is your collarbone. Medical people love having fancy names for these things. So all 206 bones have got an individual name. Some of them are quite big. Some of them are quite small. Some of them are just plain ordinary names. But each bone in your body has a name and has a function. Metabolic bone disease refers to a group of conditions that affect bone strength or integrity. And they can be due to things such as deficiency in vitamin D, loss of bone mass, and use of certain medications such as steroids or chemotherapy. Arthritis is an inflammation of the joints, and you generally are going to get arthritis, and I always say it sort of in inverted commas because arth means joint, itis means inflammation. So arthritis isn't always the deadly disease that we think it could be. It could just be a simple, you've had an injury, now you've got an inflammation in the joint, that technically is classified as arthritis. And there's different types of arthritis, which we're not going to get into tonight because that is a scope for another whole talk on its own. But know that arthritis isn't just age-related. It often happens post-injury as well. And there are different things that cause it. Arthritis can also be an autoimmune disease, just by the way. And this can cause pain and a limited range of movement. So those who have ever suffered with arthritis will know suddenly fingers can't bend, wrists can't move, legs don't bend so well. You have pain and discomfort in the ankle, for instance. That is all arthritis. Several things can cause arthritis, including the breakdown of cartilage that's found in joints. Remember, as I said, between every two bones in the body, there's generally a joint. Some of those joints are fused, but if that joint is not fused, it has got cartilage over there. And some of the causes of arthritis are autoimmune conditions or even infections. And then you also get types of bone cancer. So cancer can develop in the tissues of the bone or in the cells produced by bones. And if you fracture your bone, for instance, it's quite a fascinating and involved little system as to how your body heals itself. And I don't care if you are 1 week old or if you are 100 years old. If you break a bone, your body is going to attempt to heal itself. And if you've ever seen a building that's been demolished and a new building raised in its place, that really is how a fracture works. So you fall and you fracture your bone. Instantly, there's inflammation.
Giselle, ek weet nie of ek die stoof afgesit het met die rys vir te karre maak.
Just going to try and mute over here. Apologies. Okay. I'm just going to hide this again. So, as I was saying, if you fall and you break a bone, for instance, instantly you've got inflammation because that's your body trying to protect itself from any bacteria that could start to develop at that site of injury. And there's also instant swelling, which again, as I say to my patients, if you're in a car and you have an accident, generally you will have an airbag that will trigger to protect you. We as a body don't have airbags, we've got water bags. So as soon as there's an injury, you will see that there's heat and then swelling to cushion the bone because fluid comes along to cushion that area, to stretch the skin and to limit movement in that area. And I'll get into more of that later as I go through the talk. But essentially what happens is that within minutes and hours, and it takes a period of upwards of 6 to 7 weeks, sometimes 8 weeks, dependent on your bone density, for the whole process to happen from injury to healing. But basically, your body will remove all the broken bits of bone. So think of that building that's been now demolished and they take away all the bricks and debris. Then it starts to create its own little bricks known as osteoclasts, which are little bone cells that develop. And so your body's already preparing those bricks. And then with time, those little bone cells get sent along to the fracture site and start to layer up almost like cement until your bone is now healed once again. Now, what happens with your bone cancer is you still have these little bone cells that are forming, but what happens now is that they forget to stop growing. So you've got a fracture, the bone cells come along, they knit together, the bone knits back together again, it reinforces almost like a weld, and your bone is nice and strong. Now, a bone cancer is those little cells form, but they forget to stop forming. And you develop, as you can see, these little tumor things over here. And some of them can be really, really nasty. Some of them are, well, you will basically end up losing a leg if you have a lot of these cancers in the bone. We also have other issues. Here's my presentation. Cancer that forms in the primary bone tissue is actually quite rare. Quite often, these bone cancers are what we call metastases or secondary cancers that form quite often from breast cancer. So we'll talk about a primary and a secondary, and a primary cancer starts in an area like breast or prostate, and if it metastasizes or spreads, one of the areas that it will go to is bone. Now, cancers of the blood cells produced by bone, such as myeloma or lymphoma, are more common. So these are other types of cancers, and any sort of oma at the end of it is a cancer. So lipoma technically is a cancer, but these are all big fancy words again. Don't stress about it, but just be aware all of these things tend to start in your bones and your skeleton. Now, a spinal curvature is when the spine doesn't curve in its usual shape. Now, if you're looking at yourself from front to back, your spine needs to be straight. If you're looking at it from the side, you'll see it'll curve in at the neck, it'll curve out over your thorax area, curve in at your lower back area. So that is your classic S shape. If that S shape develops from the front to back, as you can see here, this little graphic here, that is known as scoliosis. So scoliosis is an S shape of your spine. I have a theory as to why this happens. It usually happens in adolescence. So specifically young girls, anything from about 8 years onwards. And if it's caught early, it can generally be corrected quite well with bracing or surgery. They try not to do surgery on a young spine, but sometimes that is the only way to do it. But the results are pretty good. If it's left for too long, you will end up with a degenerating spine and problems, but one tends to learn to live with it. Unfortunately, it's not a very pleasant condition, but you can live with it. So typically, the spine follows a gentle forward and backward curve. There are three main types of spinal curvature. Kyphosis is normally found up this area or the thoracic area, and it's that curvature that way. The next fancy term is called lordosis, and that is found down, here's my cursor, down here in the lower part of the spine. So this part over here. And that is where the curvature does this. I hope you can see my fingers on the camera over there. And then scoliosis is your typical S shape or even a C shape where something like this, there's a curvature there and a curvature there. Sometimes you can just have one long curvature. Sometimes you'll have a rotation in the spine as well. And we come up with all sorts of wonderful fancy terms over there like kyphoscoliosis or with rotation, etc. It can be quite a bit of a tongue-tying exercise, but you don't have to worry about any of those things. So we've now learned about the problems that you're going to find in this skeleton. How do we look after it and keep it healthy? And obviously, one of the main ways is through diet. So the skeletal system provides the foundation for all of the body's movements, in addition to other important functions, as I've already spoken about. So we need to consume calcium-rich foods, and these include leafy green vegetables, broccoli, tofu, and fish, such as salmon. Obviously, we know about milk and that sort of thing as well, but not everybody drinks milk. not everybody uses dairy. And quite sadly, not everybody is into the vegetables. We also need to get enough vitamin D. Most people get plenty of this by spending regular time outdoors, but a vitamin D supplement can help those in areas that don't get much sunlight. And as we've been learning recently, we are generally not getting sufficient vitamin D because we are not spending sufficient time outside with sufficient skin area open and exposed to the sunlight in order for your body to actually utilize it. And if you're covering your body with sunscreens, you are not going to be absorbing any vitamin D. So yeah, it's one of those things that one's got to look at carefully and decide. And my suggestion is take a vitamin D supplement in any way, because with today's diet, we probably are not getting sufficient D as it is. And we need to do weight-bearing exercises. And these include things like walking, jogging, and climbing stairs. I'm very fortunate in my job in that I get to spend quite a bit of time during the day running up and down a hill from my office to my local hospital, and then running up and down the stairs. So I get to do the walking, I get to do the jogging, I get to do the climbing stairs, and I get to do the weight-bearing exercises, because quite often I'm carrying things like wheelchairs and crutches and braces and various other things like that as well. So it's something to look at. You don't have to go to gym. Going to the gym will obviously get you some very good weight-bearing exercises, but picking up a 1 kilogram bag of flour will be a good weight-bearing exercise. Getting a very light dumbbell, pick up a 500 ml bottle of water. That's all that you need. Even a 1 liter bottle of water, because that gives you roughly about 1 kilo. So it's just the basic things. And walk, because walking is one of the best exercises that you can get. And specifically now with the fuel prices going through the roof, I think a lot more of us will start to walk one of these days. But we also need to wear protection, because if you are riding a bike or playing contact sports, the risk of injury is quite high. As you know, crash helmets were designed and invented for a reason and forced by law for people to use them a good few years ago, because it was found that when you get thrown off a bicycle or a motorbike, your head is generally the top heavy part. So it tends to hit the ground first. With a helmet to protect, makes a big difference. Our skull technically is the crash helmet that is there to protect the brain. But we also need to protect our skull, which will then do a better job of protecting our brain. So the skeletal system consists of more than just bones, as I said before. It consists of bones, cartilage, and ligaments. And when you look at the human skeleton, the 206 bones and 32 teeth stand out. But look closer and you'll see even more structures. The human skeleton also includes ligaments and cartilage. So cartilage you can think of as a cushioning between the bones, because if you think of a table, I'm using, apologies, I'm using a table over here, or even the floor. If you think of, if you've got tiles in your house, if you didn't have any flesh on your system and you walked with no shoes or anything like that, and you slammed your bone into the ground, it would hurt. If you are walking barefoot and you slam your foot onto a tile, it's going to hurt. But before you feel that pain, you're going to have a lot of fatty tissue and muscle there to protect you. Now, it gets more complex as you go higher up. So your knee joint is quite a complex joint. Your spine, your pelvis, your shoulder are all quite complex joints as far as ligaments, cartilage, and muscles are concerned. Now, ligaments are bands of dense and fibrous connective tissue that are key to the function of the joint. So the ligaments control how your joints move. Cartilage is more flexible than bone, but stiffer than muscle. As I said, that is your cushion. And if you think of cartilage like a sea sponge, you've ever looked at a sponge that comes from sea? If you leave it out on the rocks to let it get dry and you squeeze it, that sponge will very quickly disintegrate. If you make it wet, it becomes a lot more slimy and more pliable. And that is pretty much how our cartilage works as well. So cartilage helps to give structure to the larynx and the nose as well. So if ever you hear of somebody who's broken their nose, technically what has happened, then this nasal skeleton ends roughly about there. The rest of this structure here is cartilage. So when you break your nose, it's the cartilage that gets knocked off the skeleton. I hope that makes sense. And cartilage is also found between the vertebrae and at the ends of bones, like the femur. Again, the adult skeleton is made up of 206 bones. And these bones provide structure and protection and facilitate motion. Now, the bones articulate to form structures, and the skull protects the brain and gives shape to the face. I think we'd all look quite funny if we didn't have the skull over here. The thoracic cage surrounds the heart and lungs. The vertebral column, commonly called the spine, is formed by over 30 small bones, sort of like children's building blocks. If you've ever played Jenga, you will understand how your spine is made up. Then there are the limbs, the upper being your arms and the lower being the legs, and the girdles that attach the four limbs to the vertebral column, namely your shoulder joints and your hip and pelvis. So the skeleton, as you can see over here, protects the vital organs. So the brain is protected by the skull, the lungs are protected by the ribs, the heart is located between the lungs and is protected by the ribs, the spinal cord is protected by the spine or by the vertebra, and the liver is protected by the ribs as well. So our ribs play a very important role. Again, we'll go through, the brain is surrounded by bones that form part of the skull. And you can look at the skull as a type of crash helmet. The heart and lungs are located within the thoracic cavity, and the vertebral column provides structure. In other words, it's somewhere for the ribs to be attached to and protection for the spinal cord. And the thoracic cavity contains the vital organs such as heart, lungs, aorta, etc. The vertebral column contains the spinal nerves, which run signals from the brain, central processor, to every nerve in the body via the central channel of the spinal cord. We went through this a couple of talks ago. And the bones also produce blood cells from marrow. Check, I've only got about 5 minutes left over here now. So there's usually an interaction between skeleton muscles and nerves that move the body. So I think before I get into any of that, I'm going to end my talk over here, stop my sharing, and we'll get into that next week. So we'll get into how the muscles and the ligaments work next week. So I hope that made a bit of sense for now. I'm going to stop recording.